So go ahead and call the meetings to order. You want to do the roll call and do we have a quorum?
Sure. Yeah. Okay. Kathy McCoy,
Present.
Lorraine Gouget,
Here.
Mark Helwig,
Here.
Grant Gerber,
Here.
Andy Alvarado,
Here.
Mike Wohler,
Here.
Reed Schumann,
Here.
Doug Motek,
Here.
Bruce Paquette, Katie Bellinger, Ryan Reed, John Yackel, Elaine Smith.
Here.
Marshall Savitsky.
Here.
Oh, good. And Julia Lyons.
Here.
I believe you have a quorum.
Great, thank you very much. Let's go ahead and.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, liberty and justice for all.
We have certification of compliance with the open meeting law.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay. And I assume everybody's had a chance to look at the meeting agenda. Is there any changes or reordering of anything that anyone would like? If not, we'll move on to public comments. Is there anybody online or in the audience who would like to make a comment? Okay, none. We'll move on then to approval of the minutes from the previous meeting.
Make a motion. Second.
I have a motion by Mr. Helwig and a second by Mr.
Sure,
Wojtek.
yeah.
Sheriff Wojtek to approve the minutes as printed. Any discussion? All in favor?
Aye.
I'm gonna think. Moving on, then we have the jail report.
Thank you. April of 23, we see an average daily population of 72 and a half. 15 and a half of those females to 57 males. Average probation incarceration was 14 inmates. Average pre-sentence incarceration a little over 48, and the average sentence incarceration we sit at approximately 10 and a quarter. Time of the report, we have 1 on electronic monitoring, currently being housed in Barron County. We had 14. The day this report was generated, there were 68 inmates. For the month for the bookings, we had 12 inmates that were employed at the time of arrest, 56 unemployed inmates at the time of arrest, or that's our current population, with an unemployment rate of 82.3%, which I think is similar to last month.
Questions?
Could we have how many bookings for that one?
Yeah, that shouldn't be a problem.
The 14 that were housed in Barron, are those all females?
Yes.
And Madam Chairwoman, is there any reason why they're still out there? I thought we'd hired some more female jailers, or some came off maternity leave and you guys were in better shape.
No, we have not got any that returned yet. We are expecting one in July, beginning of July to return. I received notification of one of our females that's out on a maternity leave may not be returning. We do have 2 females that we did offer part-time positions to that are just going through the interviews, psychological exams. Right now we have one, I believe, who will start with us on the 22nd of this month.
Additionally, we have the concern, with COVID and the hirings, we have quite a few jailers who are right at their 2-year limit. One, they're supposed to be certified within a year. We have the option or opportunity to ask for an extension. And we have some coming up here right at the end of their extension. So we have to send some jailers to jail school, which is going to shortfall us again. So that's one of the biggest reasons for the delay in bringing our females back because of that. And a lot of these are female jailers that need to go to jail school. That's 5 weeks. 5 weeks. 5 weeks.
So do they do that as they sign up, or is that automatically set up already, or?
We send them, and it's through Northwood Tech. It used to be WITC.
Oh, okay.
We try to send Northwoods, but we haven't, Northwoods, I believe only have one or none a year, so we end up having shipped
Good
to,
point. Yeah.
either CBTC or Rhinelander, which is even further away yet, so,
And there are no online options available.
no, there's no online options for James.
Have you ever, tried to set something up at the university? Because I'm trying to set up more training and certification, those kinds of things, so we keep our people local and get them what they need. Did you ever have a conversation with them yet?
We have not, typically, we're into organizing enough. We let it up to the technical colleges or universities. I'm not aware of any of the universities doing any of those programs. And you have to keep in mind, that's all under the state umbrella with training and standards. They set the requirements, the benchmark standards. So everything has to be compliant with their minimum
I
standards.
mean, not so much that they have to do the training, how's the training? I mean. if
Well,
they can come
the
in-
instructors have to be certified and
Yeah,
approved
but-
by training and standards.
But I mean, just to have it on campus there, because what we're trying to do is
Are
build.
you looking
more-
at doing it at your?
No, I'm just saying there's an opportunity there, I think, to have it closer to home and have more people trained. Be quicker, I mean. so-
Are you saying bring the train?
Bring the trainer.
Train this year, yeah, not, have,
Right.
yeah, because that might help,
Yeah, gotcha.
and, just for future. plans.
One of the problems we've been dealing with, there's been such a turnover with jailers, they haven't had enough attendees. Because they want 12 attendees to have a class, and I believe they've even had some scheduled and canceled because they didn't have enough attendees. Because of the turnover with jailers.
And then I have to apply to seek those staff members. We have a district that we have to train in, which is, I think Northwood Tech is the only one local that I have to ask for an outside extension to go to New Richmond, or so it's all what they.
So then it's the whole air, all the areas.
Yes, I got one more question. So guys, the 48 pre-sentence inmates, how long have they been in pre-sentence? And then Andy, is this what our second courtroom's gonna address, this number?
Yeah,
And who's gonna track that, and when are we gonna hear about that?
well, we'll continue to track it. I mean, that number should go down because they should move through the court system sooner. Probably, I mean, the one thing I'd caution though is don't anticipate that the jail numbers will move, because right now with the way the people waiting for trial, once they go through trial, then they get credit for time served.
Yeah.
So it could balance out that they are serving more of their sentence, more time in jail post-sentence than pre-sentence. So it wouldn't overall impact the jail numbers. But it should bring down the number that are pre-sentence versus sentence.
Okay.
I will say on our end, when it comes to the pre-sentence, I do talk to Caleb with scheduling. So if people are just waiting for a plea and sentencing, and some, we have time that something, a jury trial comes off or something opens up, I'll contact Caleb to kind of get a list and try to coordinate with the attorneys to get that plea and sentencing moved up to help if they're going to be released, to potentially get it, so they're not sitting 3 months waiting for a plea and sentencing.
Yeah,
Right.
yeah.
So we are trying to do what we can there, but it's all coordinating with the attorneys too. So, but me and Caleb will follow up with that to try to move what we can sooner.
Yep.
But there's only so much.
But you're aware of that number, right, Anna? And as a second courtroom opens, you think that'll?
Yeah, there's gonna be lag time, because I think the occupancy date to start that second courtroom is gonna be August 14th, but there's a lot of training, like,
Training.
what Judge Isham's gonna have to do, her mentoring, and there's gonna be a lag time there before we get to that point, but I mean, it'll open up time to get things through, but you can only move as fast as everything else is moving too. So,
Swearing in.
well, August 1st, I
August
believe
1st.
she's gonna do it.
August 1st.
Yep.
I don't know if you know the answer to this one, Anna. So something we don't talk about as much, we talk about, the judicial capacity and reasons for the second courtroom. I'm assuming it's here because it's statewide. Is the other thing that slows up getting these cases to trial is a lack of public defenders, getting counsel
Yeah.
for people. Is that an issue?
Yeah, that is that. I think I had 7 last week that I was looking for court appointments, and it probably, over the last month and a half, it took me about a month and a half to find 7 attorneys, or to find 7 people attorneys. And it ended up being one attorney out of Milwaukee that stepped up and was like, hey, I'll help you out. But
Through
there's just nobody that will
is
do
that,
it.
are they like the Milwaukee attorney? Does he help through Zoom meetings or?
He does Zoom, where judge is super flexible with Zoom, obviously, because if you don't have people to take them, they're not gonna wanna drive. But we've tried to coordinate his calendar that if he's gonna be up here and he's gonna be taking cases, well, I'll make sure that I stack his cases all on one day, so he's here taking care of everybody and not trying to make multiple trips. And then if we do it that way, he'll ensure that he'll meet with them, they'll be able to meet him when he's here that day. So it's, you know, you can only do so much, but
And so I don't know this, so sorry to ask questions here. I could ask this anytime, but so I know some counties where there's lack of public defenders, public defenders are paid by the state.
yes.
But if you don't have public
If you don't
defenders,
qualify, then you have to petition the court for a court-appointed attorney through like a motion or petition. It'll get approved and then I'll get those and then I reach out to the attorneys to see who will take them.
well, and I think there's even some counties, if you don't have public defenders, the counties are paying directly to attorneys to represent people to get them through the
That's
system.
the court appointment is, yep, and then if, in some cases, if I can't find someone who will take the case, then we'll have to pay more, like it'll be
Right.
110 or 150.
And that comes out of our budget.
Yes.
Yes.
That's rarely, but when you get the high felony cases, a lot of attorneys don't take those, so you have to go outside to find someone who will
Right.
take it.
Kathy, Andy, is that in our budget or the court's budget?
It is, but it's increased the budget. I don't
Oh, yeah,
know how
right.
much, but that's where, and that's not a county issue. We just talked about this on a statewide basis Monday. And I think this, in the state budget that's going through now, the public defenders are asking for more money to increase the rate that defenders are being paid, so we get more people interested in doing that.
It's gonna ask
Right.
that.
Yeah, there's not really too many, the public defenders there, I mean, they have issues with, in their own sense, but for the most part, if they have a conflict out, then we'll appoint, finding court-appointed attorneys is challenging. But I think the public defender's office, I work a lot with Annette to try to accommodate. If she finds an attorney that's in southern Wisconsin that says they'll take the case, but they can't make it here a certain day, or they can't come here unless the afternoon, I'll move to accommodate her finding someone to take the case. And that's not out of our budget, that's just to, you know, so
I
they'll take
think I
it.
did bring up before, when I went to one of those judicial trainings, I heard from, she's like head of the state public defenders, I think she's Tommy Thompson's
Yeah,
daughter. I
Kelly.
forget what her name is. But anyway, she was saying that they are underfunded and big turnover, you know, they'd like to be able to pay more, and she's gonna ask for more money, so I don't know where we are. But it impacts everybody.
Yeah.
Lorraine, isn't the tribe looking at a public
Yeah,
defender
we're
too to
looking
help
at
these?
getting them.
We gotta move on
Yeah.
that then.
That's a good question. What is the process for the county actually to hire a public defender?
I know.
That's state regulated. That's-
Yeah, I don't think we would hire.
Yeah, that's the state would have to, I mean, and even, you know, if you get the public attorney, they can take cases, but you know, if they have conflict with people, they can't take. And it's the same with court appointment. If you have 3 people that come in and they're all arrested on the same incident, only one attorney can take one of those 3 people.
Right.
And that's gonna be, you know, if the tribe decides to do that, that's gonna be the same thing. If you have 3 people, only that attorney's only gonna be able to cover one person.
Gotcha.
Cause it's a conflict, if not. So, you know, to be able to have a pool of, you know, that we just don't have there's no local attorneys that really take those.
We don't really have a lot of people attorneys, you know, if you compare us to other
A
companies.
majority of the attorneys that are appointed to cases are from Milwaukee, Hudson, Ashland. There's not many, but they're not local. Luckily, they enjoy doing Zoom, which saves us money in the budget as far as paying mileage. Because they can bill for mileage.
But it was important for the tribe to have representation. For people to do that representation, so it may not help all the way across, but it'll help some.
Mhm.
And, because then they do that, have their,
Mhm.
whatever's happening.
But if the tribe funded a position for the public defenders, I mean, I know that other tribes will partner with sometimes counties so that they can, like for a police officer or something, but it would work the same way, I think, if you would talk to the public defender's office, see if you could fund the position, that might help.
I mean, the struggle is they have open positions. It's just finding someone who will do it.
Yeah.
I mean, the turnover there's been probably 6 different ones since I started 4 years ago. It's like when you have open positions and no one's applying because they're not getting paid.
Yeah.
You know, how do you fund a position and then you can't pay them more? So it's kind of like, you know, what do you do?
I think in the state budget, it's competing because they're asking for more money for DAs because the district attorney's offices statewide are having the same problem of retaining those individuals as the public defenders are having a hard time attracting people willing to take on those cases. So apparently there's a lack of attorneys, believe it or not.
Yeah.
Never thought
Yeah.
that would happen.
Yeah,
Well, I'm glad you're on that. That's great to hear.
yeah.
So the other thing is, in terms of our jail population, where are we at? Are we at 80% capacity, 90% capacity, 60%? I mean, roughly?
If we have 14, that puts us around 50 some in-house. And I think we're full at 104, so.
Okay, so we're well below capacity.
Yeah.
That's good. I mean,
Mhm.
that's good to hear from us,
Yeah.
point that we're moving people. out of the system.
Yeah.
Getting
Had we had adequate females, we'd be able to bring them all back. We
without any problem.
correct, but we have bed space, so.
Nice.
Our numbers are declining.
That's good. That means things are, yeah. Okay, does anybody else have any comments on the jail report?
Yeah, right.
That was our goal. We were gonna use the time.
Okay, we'll move on to criminal justice coordinator.
I was hiding. Okay, so May numbers, we are at pretrial, we're at 70 right now. Diversion, we have 11 active. We have 7 referrals pending for diversion. We have 19 diversion cases completed. 2 of those are from last month. We have some that are determined eligible, but I don't know that exact number right now because we have referrals pending. And I wish I could give you an exact number, but I don't know it. I can send it out. But Katie Ann is our diversion coordinator, and she has some that haven't been exactly determined if they are eligible. So I didn't want to put the number in here because I didn't want it to be wrong. So we have 2 diversion cases that are pending review bailed hearings, meaning they haven't been compliant in their diversion cases. So we'll see what happens. We have the ability to request extensions, which we'll see what happens with those. It's kind of up to the judge what he wants to do with those. So they could either get charged or they could get extensions. We'll see. We have 54 on the wait list. 23 of those are incarcerated. So I guess 31 technically. However, Carter is our new pretrial case manager, and we were just right before this getting his caseload bulked up. We didn't get completely through it, but he is ready to take on a caseload. So we're able to clear out some of that wait list. We got through it some, but we're gonna meet this afternoon and hopefully get him about 20 to 25 people to start. And then from there, we'll get more off. The concern with taking people off the wait list, and I've said this before, is contacting them. So if we don't have current contact information, we can't get them into the office. So if they don't update their information either with us or with the clerk of courts, we can't get them in for their appointments. So we're going to try, but if that is a term of their bond to update their information, if they don't, and we do give them an ample amount of time and we do every effort to contact them, but they will get a violation report. Usually what the judge will do is end up calling them, you know, they'll get picked up, they'll be brought in, and he'll reinstate their bond if they haven't updated their information. But again, that's up to the judge. So hopefully next month, our wait list number will be way down.
Is that helping them write travel office? For the contacts for the people?
Yes. Yeah, that helps. It helps actually now. So myself and Michelle are working out of the jail now. Our offices are out of the jail. So only our case managers are working out of the courthouse, and they rotate their schedules between this office, the tribal office, and they have also a remote day where they work from home. So that's also helpful because obviously if anybody has seen our office here, you can only have one case manager in there at a time because it's yeah. Because you can't meet with clients, multiple people at a time. So now that there's 3 of them, which is helpful. So Carter is at the tribal office on Mondays. Court is on Tuesdays, so we're all here on Tuesdays. And then Katie Ann is at the tribal office on Wednesdays. Heather is there on Thursdays. And then they all have a rotating work from home day.
You have 1 or 2 offices out there?
1. And then, what's that?
And then the numbers are recently, I got them just before the meeting, so they are attached to the packet now.
So I sent them to Lynn.
They're not in there.
I run the
They're not in
numbers
there, no.
right
They do
before.
know.
I
No,
come to
the whole
meeting,
agenda attached to
so-
that spot.
Oh,
My mistake. I attached the whole agenda.
I'm looking at it, right, yeah.
Also, we just went to WATCP and we had a group of 11 for our treatment court work group, which was pretty amazing. We were one of the biggest teams there. So that was, I considered a huge success.
Yeah.
And we came back with, of course, some of the sessions were kind of long and it's hard to sit through, but I can't give people enough credit because that's a huge dedication out of your day, out of your, we have a treatment court work group meeting after this and it's 2 hours every time we meet. So not just going to conferences, but coming to our meetings, reading through policies and procedures to get all of our things together to get our treatment court up and running. It's a lot of time and effort and dedication in addition to everybody's regular job duties. It's a lot.
So does anyone have any questions?
so Becky, what are your current roadblocks to diversion? I mean, I see you have a lot pending and quite a few completed. Is there enough diversion opportunities for people? Or is that where we?
I
what can we
don't-
help with?
I think our biggest roadblock to diversion is that we don't have enough. So people have to score either low or moderate risk. They have to fall into the TAD requirements. And then we have to get them in for their intakes. And getting people to score with those assessments we have a lot of people that score high or moderate high. And so then they would be more eligible for like treatment court.
Can you expand on that for us? Because I think the TAD grant was applied for under a diversion program of X. It was why it's low risk, correct?
Diversion is low risk.
That's by our choice here.
That's by TAD standards.
TAD standards, okay.
Yes. So we don't have anything to do with that. We don't have any say in, that's TAD standards.
For the grant.
Correct.
Right, okay.
So if somebody scores moderate to low risk, they're eligible for diversion. And then they can't have a violent chart, it can't be a violent arrest. And they also can't have an OWI. That's an automatic no. So that's kind of a barrier. I would say that's our biggest barrier because a lot of people score high risk. High or moderate high.
And when are they assessed or scored? Right away, or is someone going to jail? after that, or-
Ideally, yeah, Michelle is our pretrial specialist, and so ideally, we score them when they're newly arrested. Now, if they're really high, we can't screen them when they're high. So she will wait until they're coming down. And if it's like a Tuesday and they get a bond for us, they come in, and if we have time to do an intake, we'll score them then, or we schedule an intake for them to come back. Again, if we try to get people to understand that when they're referred to us, that's a term of their bond and they have to show up for their appointments. They don't always understand that.
When I went to that training, everybody was talking about, I was sitting in some group and they were asking how many of your counties have MAT inside the jail. Only 2 counties in Wisconsin supply MAT in the jail to the inmates. For instance, when somebody's out and they're undergoing medically assisted treatment and they're arrested for some reason and they're put in jail, they're not given their medication while they're in the jail. And so there could be a greater risk of relapse in their release, especially if they see their home. So I think that's kind of interesting.
Yeah.
They're not free problems,
Yeah.
they can do it. Just want to bring that up.
So how did they do that then? How did they get it into the jail?
They don't get the medication.
No, the ones that do have it, how did they get
Oh, I
that?
didn't get it. Let's talk to them.
Something. Group, they're having addictions. And,
It's like any other medication, so I don't know what the rules are.
what are the rules?
You have a diabetic that's in jail, do they get their medication?
They do, yes.
So this medically assisted treatment, medication, whether it's Suboxone, whatever it is, they're not given that.
We just had something recently just popped, I forget who it was, but with ACH on board, the inmate returned, I believe, back from a treatment facility, and they had medications to assist when he got out. We were willing to continue those medications pending a clean urinalysis. So if somebody were to be, let's say, newly arrested coming in off the streets who had been in a program, and they came in and they failed a urinalysis test, pop for heroin, methamphetamine, whatever, those medications would not continue in the jail. If they were clean, if they were picked up on an unrelated charge, but they were still on medication, we would continue that.
And they were willing to do that.
Yep.
Well, that's good to know.
Well, and there's not a lot of MAT providers around either. We fought clinics for a long time.
And who administers it then, the jailers?
The nurse,
The nurse?
Well, all the drugs, medications will go through the jail doctor. Jail staff will administer or give out medications as needed.
And I would guess the jail doctor is not an MAT certified provider.
Yeah, it takes a while. I
Yeah.
understand. There's certification.
there's less requirements, so they're taking that away. Make it a lot easier.
It's the problem.
Okay, let's move on to Health and Human Service Report.
Okay, so while you're switching or coming up here. So from a Health and Human Services perspective, we've had a bit of transition and change. So I have moved into the director position. One of the things that we are focused in right now is our child welfare program, looking at staffing and getting quite a bit of assistance from other counties as we move forward. So youth justice is a bit impacted. Sarah is helping us be able to maintain and keep things moving when we need to have assessments done. So right now, what Sarah has for reports, she has for 2023, she's had 28 referrals. She has 15 ongoing cases, 5 pending intakes, and 7 pending court cases. We have Rusk County assisting with 7 more ongoing cases, and we have Mike, I can't pronounce his last name either, Andy, coming in to help assist, and you know more about him. And he'll be picking up some cases as well for Sarah.
Now, who is Sarah?
Sarah is our youth justice lead.
So did the county lose all their for counselors, like what I mean, police managers.
We're in transition with that. We just hired a caseworker. She just started on Monday. We have I think we just got a verbal offer that was made and accepted, and that will be for Kinship Foster and ongoing. We still have Erica coming in, so she does the family support. And we'll still have, Carla has put in her resignation, and she'll be retiring as of tomorrow is her last day. So we've got have a bit of transition. We do have a contracted supervisor who works 20 hours a week. I'm working really closely with Susan as we make these transitions. We're interviewing together, have quite a few meetings and discussions throughout the week. So we're working through it. We're gonna end up hopefully with a great program in the end. So I'm very confident.
Does the county have the same problem that Tribe has, where we have those positions posted and nobody's applying?
Yeah.
Yep. I mean, I should say, we've done the interviews. We're not just taking anybody either.
Yeah.
So we want to build a department that we can retain. So,
Yeah, so we had 3 interviews
Yeah.
last Friday, and there was only one that we put an offer through, so we're being very selective on who we bring in. The other thing that we'll be doing is really having a great onboarding process and training program as we move forward. Because when we get them in here, we want to make sure our staff feel well supported and we are able to keep and retain them.
yeah, and I think, is your meeting today, or do you already have it with Tibissum?
I meet with Tibissum, Carla and Susan this afternoon, and then we'll have continue meetings with Tibissum as we move forward.
So, yeah, it's, I don't know, a bit patchwork. That's the best way to patchwork right now. But like Julia said, Russ County's picked up some ongoing, actually, it's not Russ County, it's one of the Russ County employees, actually the supervisor is doing LTE work for us. The Washburn County CPS supervisor is doing LTE like nights and weekends. Mike is a retired Superior police officer that has a child neglect investigating background. So he's helping on the youth justice. And then we've got other counties helping, like Wood County, Lincoln County are supplying people to cover like on calls at nights and weekends. So if there's an incident and deputy needs to contact somebody to find out what to do, they can call the on-call person in one of those other counties. So we've gotten good help. I was sharing yesterday that it's patchwork, but we're not the first county to go through this. So we've had other counties explain to us how they got through it, and we've been able to follow kind of their blueprints. So I think short-term pain, long-term, much better position for the county.
Like, we think, because our graduation for the college room, which was last night, is Saturday. So watch those graduates. They're coming out and they're going out to the workforce.
Yep.
In time into those opportunities to get them the training and get them on board for this career. So that'd be good to keep an eye on that
Mhm.
as it comes up, you know, very fun. And then when the requirements are the certification change, which you mentioned last night, that helps too.
Yeah.
To train and get them in there.
Traditionally, historically, maybe better word, you wanted 4-year social work degrees, so these people would become social workers. That changed a number of years ago where you could call them social service workers, where maybe they had a 4-year degree, but it was not a social work degree. And now the qualifications have been, I would say, reinterpreted. So you can take a balance of experience and education. So like our newest hire has a 2-year human services degree, but a lot of years of experience working in social services. So that's the other, so it's broadened the degrees and the education you need to require. Like Julia said, though, the flip side of that is having a better onboarding and mentoring program, and the state has increased their education component that they provide to new CPS workers.
Within the department. I hate to ask, I'm sorry, but I just have to.
My priority at the moment
Yep.
is really getting CPS in check. And so that is on, we'll be looking at that, Kathy, but we need to get this fire taken care of first.
Tried to, as
It's everywhere. I
It's
know
everywhere.
clinics and-
I can tell you North Lakes did just hire, 2 psychiatrists who will be, I think, working remotely. And then they are looking, and they have 1 pending that will be onboarded in-house. So, we are looking at it not only from the county, you know, internally, but, as a county in general and regionally, what we can be supportive
Just to have
with.
more
So,
resources.
yes. Mhm.
Just follow my things.
I'm not sure, do you know? which
What's
one?
that? Paul Workman, is he still at my house?
I think so.
I'm
At least
not
6
as
months
familiar-
ago.
Yeah, I'm not as
When we were
familiar with
doing
the
this.
names, I'm
Yeah.
more familiar with the numbers.
Yes.
Andy, where's all this money the governor promised us for mental health and revenue sharing?
You have to ask the legislature.
Yeah.
They're working on their budget.
Uh,
The governor proposed it in his budget. Yeah.
They must agree that there's a mental health crisis and.
I think I've seen the legislative budget pieces or have some components, but they're not the same as the governor's.
Yeah, the pieces that are left in there for sure, it looks like developing these regional behavioral health areas, but we're actually your intake would be happening not at a hospital, but at a regional site that is specific for bringing in crisis. And working through that, it's also supposed to help free up law enforcement, so that's been a big push, everybody working together. However, you can't support a clinic of that type in a rural area. So our question is, what does that look like? How do you have a freestanding? Where would it be? How do we manage that up? And or how do we, ideally, what would happen is the funding would go back to the critical access hospitals that used to be able to do that for us, and that funding was pulled away. That might have to be a thought process on how we move forward with some of this in the future, but again, it's all in the legislature.
Writing a letter as a citizen is a good idea. I was just thinking, you know, there are so many kids that are placed out of the home due to this drug epidemic that we have. So much trauma. And I always encourage the guardians to try to get the child into some kind of counseling.
Well, we said a special adult analysis.
What clinic were you talking about, or that couldn't be in a real rural area?
It's not, it's supporting, so it's a crisis center where, so if we have mobile crisis calls and we need to get somebody cleared and moved out, instead of trying to bring them into the emergency departments and waiting to come in and kind of getting bogged down by that health system, they'd be their own standalone site that would focus really on that mental health crisis, clearing them medically and being able to get them moved out to other sites. So it can happen, but the reality is that, are they really going to put one up by us right away? Probably not. They're going to focus in on the urban areas first and see how that works. So what can we do in the meantime while we wait 5, 6, 8 years for that process to go through? So.
Yeah. So Julia, are we putting some opioid settlement money towards this?
So for mental health treatment.
Yeah.
It's providers and being able to bring providers in, and whether we can find somebody and have that need, now that we know that some of the other places are hiring in, where does our focus really, where does that funding need to go? At this point, we know that Ziki still has, I think, at least 2 openings. So there's job openings out there with pay coming in from clinics. So whether we open up our funding dollars to that or not, would we really be getting anybody hired in? So.
Speaking of, I'm sorry.
So are we collaborating with the tribe then? At least we got that big beautiful building out there. And we're building a brand new clinic. and we should be involved in that services they offer.
Yes, yeah, so we collaborate very closely with Ziki.
Yes.
Yes, we're. Well, Joyce will be speaking to that when she gives the rest of the update.
Okay.
Sorry.
All right, so let's move on.
We can go at her all day. You know?
Okay, just remember, I'm 1 week in.
Okay.
We're excited.
Well, thank you very much and congratulations. I have heard you. Somebody had told me.
All the top choice.
I'm glad that you're on board, so. Thank you. Joyce, do you have some?
Yep, Joyce.
I do.
I do. So we were approved, Sawyer County Public Health was approved as a Narcan Direct site, which means that we provide training and then we provide Narcan. We put out a flyer just to business areas, the Lake Association, Tavern Association, Chamber of Commerce, thinking some people may want training, and we got bombarded. So we actually had to create an online training site. So we now have an online training site where you can go through and take the training. At the end, if you don't have to get Narcan, but if you would like Narcan, you just give us your information, and then you can come to the front desk and pick up Narcan. It's so far, we posted that site Monday morning of last week. And so far, we've had 83 people complete training. We've issued 12 doses of Narcan, but then the in-person training that we were doing, we've had almost 40 complete that training, and we've distributed 70 doses of Narcan. I will say, as a side note, I did notice quite a few posts in Facebook this weekend about areas that maybe should have Narcan that did not have Narcan. So I think it's very important to get out there that Baziki has Narcan and we have Narcan. So if you are whatever, a homeless shelter, a hotel, law enforcement, whatever, the Narcan is available in our area and you can get it for free. So
My only fear on this.
Yeah.
Is that we got just so many doses.
Right.
In this. So,
right.
if we are getting that big of a draw, that might be something that we need to consider some of the opioid settlement funds
Yeah.
to help
Yeah.
with that, if that's continuing to be the draw.
Yeah,
I
I
had
mean,
no idea that
Yeah.
we had. no
we
idea.
were stunned. We can get a total of a little over 200 doses as part of this program. So we only ordered a few cases to start, but once this started, we've ordered it all, and we'd have concerns that we're probably going to run out before September. Mhm. Yes. Yep. Yes. We've had golf courses contact us. We've had the Jack Links Aquatic Center.
Visitor and Convention Bureau.
Yes.
And put it out online. right,
Yes.
which Went out to all
Yes.
resorts and everywhere, which I thought was fantastic.
Yeah.
actually.
Yeah, no, we've had a lot of people take the training, and as part of the grant, the only thing we need to track is essentially what their I'm gonna say career is, or something like that. So we ask, are you fire EMS? Are you in recovery? Are you part of a business? Are you law enforcement, whatever? And so they just check a box, and we've had several people that have taken it that are in recovery, which really excites me. So I like that a lot.
So you keep the jail supply too?
No,
No, you get your own?
They have their own.
we also have been working with Bajiki. So Sawyer County had a prevention coalition, and LCO had a prevention coalition. And so we have merged that coalition now, and we've created a charter document. We've created a general strategic plan. We're currently in the process of recruiting members. So we have 12 different sectors that we are trying to get membership from. So youth, parents, business, media, schools, youth serving organizations, law enforcement, and civic or volunteer organizations, religious or fraternal, healthcare, and then state, local, tribal organizations, and then substance use or mental health. So we've been needing to come up with ideas for people to join. I think we're gonna have a pretty decent cross-section. We're all pretty excited. We think that this is going to be, it's very nice to be working as one community instead of different ideas from wherever you're from. It doesn't matter. This is a community problem. This isn't an area problem. So we're very excited about that. We also applied for and got approved to have a recovery coach at Public Health. So Marshfield Medical Center has a program where they provide an AmeriCorps volunteer who gets in return education dollars, a small living amount. But we've just created the job description. And so we'll be posting this week to start looking for people. We're looking for someone local. They do need to office out of Hayward, so this can't be someone who is, doing remote. And they are going to meet with at least 10 to 12 clients on their caseload at a time to provide recovery services, but also to help get a peer recovery program started in Sawyer County to find the volunteers or however we need to set that system up to get a peer recovery program started. We are going to be working with one of the homeless shelters does have a person who has taken peer recovery. And we've met with him and talked to him. So we're going to definitely hook them up. So it's all working together.
Is it a full-time position or what are we talking?
Full-time.
Full-time?
1 year.
1 year. They can renew for up to 4 years. It would start in September and they're provided training.
All right.
So
And that our fundings, we had to put 5,000 into that or? not?
yes.
Yes.
So we had to
So
put
it's-
5,000 in each year that we would have them. But
I'll catch up. Yeah.
Opioid settlement
Yeah.
yeah,
funding
yeah.
for that. And really, all of the work that Joyce is doing right now is continuing through a grant that we have, but when that grant runs out.
Yeah.
then we'll need to look at all that coordination. So she spends a lot of time keeping us moving forward.
I'm trying. I'm trying.
Well, I think that support there and that recovery really needed for all those individuals.
It's
because
critical.
They go to treatment, go here, go there,
Yeah.
come home, they come right back to the environment.
Yep.
It does not.
Well, and it's not only that, but it's also providing them resources.
Yep.
So, they maybe don't have food or they need to figure out how to better parent or they need to figure out how to find a job. That's what the recovery coach does, is help them find those resources, just get them on their feet. Right. And it's critical. Every training we have had that we've had people with lived experiences have talked about how important the recovery coach is to their process. So, go ahead. Oh, yes. Go ahead. Speak up. No, so Justice Point has had one of them or more than one?
Well, one diversion graduate.
Yeah, one of their diversion graduates has gone through and completed the peer recovery coach
That's a good.
system. Yeah. So, and that's the perfect
Yeah.
situation, right? I mean, that's the ideal. That's what you want.
University has been offering about 3 years
Mhm.
training, so.
Yeah. Yep. We continue to work on locations for sharp boxes. We have met with a lot of different stakeholders trying to figure out exactly where to put them. Not all the places are very easy. So we hear about certain areas, but there's some areas that we would actually have to work with DNR or maybe the city or the county to have permission to put the box there. So it's not just a matter of walking out and tacking on the box. So we are still working on where the best places are to put those sharp boxes. We
have
did
some up already?
no. So we did do a brief analysis of the prescription drug monitoring program. And if you remember the gap analysis that Julia gave a while back, that's what a lot of these items are ticking off, is we're going off of that gap analysis. So one of the things we looked at was there's a prescription drug monitoring program in every state. Wisconsin has one as well. It's public data. You can go online and look at it for yourself. And so what we did was compared the stats of prescription drugs in Sawyer County to other counties and then presented that to medical personnel. And in Sawyer County, we're doing a pretty decent job. The main drug that I had concerns about was gabapentin. Gabapentin was only started to be tracked a couple of years ago when people started realizing that also had a problem with addiction. So gabapentin, according to the medical personnel, has often been what they have been prescribing instead of an opioid. So Sawyer County was a little high compared to some of the counties around us. We're still well below what the state average is. But it was enough of a number for us to at least bring it to their attention so that they know to keep an eye on it and maybe monitor what's, going on in their facilities. We also talked to law enforcement and they did drug take back day, which we think was a huge success. LCOPD gathered 17.2 pounds. Winter in the sheriff's office collected 15 pounds in winter, and Hayward PD collected 47.1 pounds. So it was almost 80 pounds of medications that were turned in on that day. And we have medication drop boxes.
I was just gonna say, because I cleaned out my parents' house and dropped.
Yeah.
A bunch of, drop.
Yeah. The sheriff's offices, the sheriff's
Oh,
offices, LCOPD, yep. Hayward PD, LCOPD, and the sheriff's, all have Dropbox. But one of the things that Hayward PD, he called us and told us, I will definitely do this again. Because what surprised him was a lot of the people coming in didn't realize he had a Dropbox.
Right. Yeah.
So we know that we need to market that a little bit more. It's on our list. But because we'll do it again in, what is it, September, when we do sweep.
Like, a little poster, the only reason I remember, somebody sent me a little poster and I posted it at the town hall.
Yep.
And about where you can drop off old prescriptions or whatever.
Yeah, we
And I
created
went out
that
there and
poster.
it was
Yeah.
like,
I think
Yeah.
we had over 100 pounds in our Dropbox.
Yeah,
Additional.
Besides, but yeah.
yeah.
Besides what you collected, yeah.
Mhm.
Well, it's nice to have the drop boxes there, but I think having a day just makes people think about it,
Yeah.
right?
Makes you think, go clean up your drugs.
Yep. And we did specifically contact the different agencies that provide hospice so that they could get the information to their clients. Because as you know, after hospice, you often have a lot of drugs hanging out. So that helped, but according at least to Hayward PD, most of the people were talking about they had seen it on social media. So that was we felt a big success.
Is there a
And
cost for disposing of that? Or how do we get rid of it?
it's law enforcement that disposes of
We,
it.
And they,
we take it down to Florida State Patrol and they take it to an incinerator.
I was gonna say, because Barron County Incinerator will take it for no cost.
Yeah.
We
Yeah,
don't sell it, Andy.
No, I just know they'll burn it for free, so I was hoping we were paying for
make a profit.
it.
Right.
Yeah.
The last thing I'll throw out is that Julie and I attended public information officer training as part of the preparedness plan. So it was really good. I thought we went to Eau Claire for a Saturday and went through an 8-hour training, and I thought it was really good training, really nice to have for this community. So
yeah, it'll help us kind of in the marketing and promotion and other pieces we can do when it's a non-emergency event.
that's all I have. Any questions?
Well, I really like that with the containers you need for those needles for the start,
Yeah.
because we're battling with other diseases also.
Mhm. Yeah.
And then sharing those needles, and I know people will say whatever when it comes to those efforts that are being
Free needle.
try to, oh, you're supporting it. No, but it's trying to prevent some of those things from happening and from spreading. And the little ones to find them, they're laying around and things are unsafe for everybody.
Right.
And we don't want to see anybody using custom, but we don't want that to happen. And so we're seeing that. And so even with pride, if you get a hold of some, maybe somebody in our.
Yeah, we have some areas, there are some areas that we met, and there are some areas on the reservation that they asked us.
Good, good.
Yeah,
So we're gonna move on.
Yeah.
I want to stay at hour. That was.
giving out needles too along?
No.
Okay, so we're gonna move on. Thank you very much for all your efforts.
Yeah,
That's great. Moving on, community service updates. Grant, you got something?
We got 2 new residents last week over there, so we only have 1 spot left, but we are still going through application and I have been in contact with Joyce and Jessica, and we will be getting Narcan certified over there and getting it provided there. And I'll be I just got the email last night and I'll be contacting them over at New Reflections as well.
To get
So,
somebody certified.
yeah, to get someone certified there as well. So,
Well, and I think you can speak to the peer recovery or the
Yep.
approach, because that's
Oh,
what
yeah.
you guys are using.
And
That's
actually,
what's
one
been
of
so
the-
successful.
the gentleman that's our overnight guy over there, he wants to get into peer recovery and
Good.
be your advisor and
Good.
stuff like that. So we're working on that. I'm just trying to get through finals week.
Yeah. Yeah.
I just want to let you know that, right now, we're still calling it homeless task force.
Mhm, yes.
We're looking at trying to get a new name for it. Mike is, getting the 501 going. We have, I think we had about 6 people, 6, 8.
He asked me last night.
About 6 or 8, yeah, probably about 8 people that were on our task force there. We have a gentleman on there that's realtor, and he's looking for facilities that we can look at. And we're still, one of the things that we're looking at, right away, is once we get the 501 going, is that Burmeister's facility.
That's perfect.
We want to get that going for inmates, I guess, or.
People coming out of.
Yeah.
Yeah.
Transition,
Yeah.
right, yeah, transition house is what we talked about.
That,
Absolutely,
the
right.
funding there will be coming.
There's no
from
place for
DOT.
people to go, yeah. Well, because isn't probation, you're working with probation then also too, because they were the ones that have been looking.
If we
at
can
it,
get
some
the
space.
on board, then it would.
Then you.
Yeah.
Yeah.
Yes, exactly, yeah. Okay.
And
So could you guys meet next again?
I think it's, I want to say the 15th on top of that.
Do you want to shoot me or email or something?
I'm meeting with Mike right after this.
Okay.
And then. So get me just, or
Fifth
maybe.
of June.
5th of June.
Okay.
And do you guys meet here or where are you meeting?
We met in the church
Okay,
downstairs in the basement,
perfect.
and we were very, we felt it was a very good meeting.
It sounds like it.
Good.
I mean, it's a big need. We all
Yeah,
know
it
that.
is.
So if we
Yeah,
can
it
get something up and running, it's fantastic.
There's so many things we want to do,
Yeah.
so many tackles.
There's community support behind it. I've had people in the community ask me, even if I know of anything where people can go, and so I know there's a lot of people in the community.
So as far as future agenda items, can we put that on next month so that we kind of have that as outstanding, yeah,
The transition.
about the housing, the ad hoc or the housing committee report or
Homeless
whatever.
task force. that's
Homeless
really-
task force,
Yeah,
yeah,
right
right.
now it's the homeless.
Yeah, right, so we can kind of keep up to date with what's going on. Yeah.
We'll probably have a meeting.
Have a new name by then. Anyway, that's okay. It'll still be the same report, right?
Yeah.
So, thank you very much for bringing
That's-
it up.
Over next door, we have 3 in there right now, going through the ones that capacity's 4. Yeah.
Okay, is there any other correspondence?
One question, who would handle the truancy court? Because you know, it's about the truancy court. in the county.
Yeah.
Girl. All right, anything else for future agenda items? We'll get that added, like you said, so we did a updated on that. Anybody else, anything or?
I was gonna add that truancy court, she's your gal. That's one of the things that's kind of been on the list until we have additional judicial capacity. So when we have a second judge, I think there's opportunity there. Like, we need to revisit the truancy ordinance and
Yeah. I don't know, major problem.
Okay. because we're weak there.
Yeah, but that kind of talked about during COVID, everything kind of fell apart. And I think there's a lot of rebuilding that needs to be done.
I've asked some questions and I'm told there's not a problem, but I think it's because
So I
we're
think there's-
under the rug somewhere.
That was when Jim was still doing it, so it wasn't too long ago.
Okay.
What
I
about
think she
addressing
left.
all the
And
unemployment?
then we never, since then, never.
That this committee jurisdiction?
We were short on time, but I'll talk to, we can bring it up next month.
Yeah,
Yeah,
perfect.
we did, I had a
And
meeting.
I
with
don't want to
North-
rush people because there's lots of good conversation, but my
Yep.
goal was always to keep this at all, so.
We did meet with Northwood and they're getting us some information on programs.
Okay, oh, we should have the next
Yeah,
meeting date, don't we?
That's fine.
So no, it's. It's
So
the
this is
same.
the-
I thought we were just leaving it, okay.
Same.
It'll be June 14th, is that correct?
So we don't sprint out of here. We need
Oh,
5
second
minutes.
Tuesday, 14th.
2 minutes, okay.
So long as we-
We got a groundbreaking.
Oh, maybe. Very
Oh,
good.
okay.
All right, thank you, everybody.